Good morning. I would like for you to meet Jake. If anyone would have told me a year and a half ago that I would be standing here in front of you talking about cancer, I would have thought that they were crazy. You see, a year and a half ago, my husband and I, Joe, had a healthy 14-year-old boy. He was a freshman in high school, second-degree black belt, loved the Ravens, playing Xbox, watching The Walking Dead, hanging out with his family and friends. He was one of the kindest, most respectful kids. In June of 2000, our lives were changed forever. We were blessed with this amazing, beautiful, healthy baby boy. He had a wonderful childhood and was easygoing. Jake got his first migraine headache at the age of 8, but they were not frequent and were easily controlled with Motrin and going to bed in a dark room. Both my husband Joe and I suffer from migraine headaches, so we knew, unfortunately, Jake was probably going to suffer with that gene. By the age of 10, they had increased in frequency and in intensity, so we took him to see a pediatric neurologist at Sinai. He prescribed a rescue medication known as Maxalt. By the age of 12, he was also taking a daily medication to try and control the frequency. Over the course of 4 years, Jake's migraines continued to increase in number and caused him to miss quite a bit of school. We were due to return for a follow-up appointment with his pediatric neurologist in August, but due to some disappointing experiences with the one we were seeing, we were left looking for a new one. We were referred to Dr. Oakley at Hopkins and went to see him on December 17th, 2014. That was the last day Jake attended classes at his high school. Sorry. Dr. Oakley did a physical exam on Jake, and right away noticed that Jake's eyes didn't move side to side. This was something that we did not notice. We were in shock. He asked Jake to smile, and only the right side of Jake's face moved. It was subtle, but you could see it. How could we have missed this? Immediately, I started going through pictures on my phone, looking for the last picture that I had taken. Sorry. Oh, there we go. Sure enough, now that it was pointed out, I could notice it. This picture was taken 1 week prior to our visit. The doctors told us he could have Bell's palsy, but they wanted to run some tests to be sure. Honestly, I think the doctors knew what was likely occurring, but they didn't want to scare us, and for that I thank them. Dr. Oakley wrote up all the tests he wanted us to have, but we were not able to schedule the tests for another week. Dr. Oakley was concerned, and we asked him for his opinion. At that point, he said, "This is serious enough, you need to go to the ER now." At that point, Joe and I knew something serious was very wrong. But we couldn't show it because we needed to be strong for Jake. After being put through a battery of tests throughout the day, a doctor and nurse came into Jake's ER room. The doctor pulled up a chair next to Jake's bed and sat down. The nurse sat down on the bed next to Jake. I have never experienced compassion like that. I looked at them, and I knew that the news that was about to be delivered was not good. The problem was Joe wasn't with us. We had already been told that he was going to be admitted for additional tests. So Joe had gone home to get us clothes. I asked the nurse if I needed to get Joe on the phone, and she said yes. I fumbled with the phone, not even remembering how to pull up Joe's phone number. It is a moment I will never forget. But then I have a lot of those moments due to the journey we have been on. It was then that we were told Jake had a mass on his brainstem. They were not exactly sure what type yet, because we would need more imaging in the morning. And neurosurgery would be in to talk about removing the tumor. I tried to listen, but honestly, some of the conversation sounded like the teacher from the Peanuts cartoon because I was in such shock. Jake was scared, and the first words out of his mouth were, "Does this mean I have cancer?" Of course, they could not answer that question, but they did say, "We're going to continue running tests." I remember him crying because his hopes and dreams for his future were now uncertain with hearing the words brain tumor. Jake went into surgery 2 days later with Dr. Jallo from Hopkins and had approximately 90% of the tumor removed, which was wonderful. Dr. Jallo came out of surgery and told us it looked benign. Words we wish he wouldn't have used. We were feeling relieved. We were told many things before Jake went into surgery since the tumor was on his brainstem. He could come out with a feeding tube, a breathing tube, or have a tracheotomy, and more. We were also told to expect his facial paralysis to become worse before it gets better. Jake did great. He did not come out with a feeding tube, a breathing tube, or a tracheotomy. He did, however, have total facial paralysis. But, there we go. We remained positive and kept saying that we will return, but the facial movement will return. Our warrior was up walking, sitting up, and surprising everyone around him. He went home from the hospital 5 days after a major brain surgery, which was Christmas Eve. We were blessed to wake up the next morning on Christmas together. He couldn't smile, but a thumbs up became his new smile. Jake soon after went through 6 weeks of temozolomide chemotherapy and radiation treatments. He was a poster child for his treatment. He didn't have any trouble with chemo, but the radiation did cause increase in his headaches. The doctors were able to control those with steroids, but the steroids led to increased problems like acne and weight gain. But while going through radiation, the steroids were a must. He couldn't continue with the headaches that the radiation was causing. Jake finished his last chemo and radiation treatment on March 11th. We settled into a new routine. He was getting regular visits by friends and was receiving home and hospital classes through our school system to keep him up in school. He was scheduled to go back to classes at the end of March. On March 24th, Jake woke me up on the side of my bed, telling me he had a migraine. Joe guided him back to bed, and I went to get his medication. Jake had a special cocktail of medications he took for his migraines since he was on chemo. I gave Jake his medication. We helped Jake settle back into bed and told him to try and get some rest. Joe went back to bed, and I went into the bathroom. Within 3 to 5 minutes, we heard an awful noise coming from Jake's room. It was a loud snorting kind of sound. I ran into his room just as Joe did. Neither of us could wake Jake. He was not responding. We thought he was having a seizure. After paramedics took him to the local hospital, it was determined that he had a brain aneurysm. He was then flown to Hopkins. and we began a 39-day stay. There were many ups and downs during that 39 days. Jake's most difficult obstacle was his body's inability to regulate the amount, flow, direction, and pressure of his cerebrospinal fluid out of his brain's ventricles. Jake had a hard time in the beginning having the external drain shut off in his head. His body wasn't able to regulate it on its own naturally, and the doctors had to turn the drain back on. After Jake was successfully able to regulate the pressure and fluid, they removed the drain. But within 7 days, he was confused, vomiting, and developed a fever. It turned out there was too much CSF again, and they had to go back in and put the external drain back on. This resulted in a shunt being put in 5 days later. The problem was that Jake's pressure was extremely low. There was one programmable shunt that would allow them to program it low enough for Jake. After our 39-day stay, we were home for 2 nights before he was vomiting and had fever again. The poor kid had numerous IV infiltrations in G tubes, which due to his confusion, he would pull out, and blood clots, which led to an IVC filter being placed. This trip landed us at Hopkins for 30 days, which had some rapid response calls in there, as well as his inability to wake up and respond, due to his inability to wake up and respond. Jake's shunt would become clogged with protein, which would lead to his confusion and vomiting. Looking back on this part of the journey, Joe and I talk about how his brain cancer was on the back burner. It was not the main issue for Jake anymore. How many times do you ever hear someone say that brain cancer is not the real problem? Jake's battle, start to finish, was 7 months. Jake never regained the use of his facial muscles, even with private speech therapy and facial stimulation sessions 2 times per week. He entered the hospital for the last time on June 26, 2015, with CSF buildup. He went in for another shunt revision surgery, but never fully recovered. After having a CT scan, a spot was seen further down his spine that was suspicious. The doctors then tested the CSF and discovered that his cancer cells were all throughout. The doctors had to put the external drain back in to control the pressure and flow, but ultimately there was nothing more they could do for Jake. It was time for us to make difficult decisions. We knew that no matter what, the Jake laying in that hospital bed would never return to the Jake that we once had. We also knew what kind of life Jake would want. And that was not it. Jake was removed from life support on July 9th, 2015. We asked that he be kept comfortable and pain-free. He was given enough medication to put a grown man out of his misery. But our warrior held on for 4 more days. Some might ask what I have learned along this journey. It would take days to tell you what I've learned. But here are some of the things I have learned about having a child with cancer. Doctors try to do what is best for their patients. They want to see their patients get better. They do everything in their power to help. When your child has cancer, you are at a loss, and you have no option but to put your trust in those doctors. This is something mom and dad can't fix. But you must remember that doctors are experts in the field of medicine, and you are an expert in the area of your child, and you have to work together. Jake was not a textbook case. Not every patient is going to follow the rules when their body is in crisis. Jake would have a regular heart rate. He would answer the silly questions that the doctors and nurses want you to answer 1,000,000 times. But we still knew there was something wrong. There were 2 occasions when we were not listened to fast enough, and it caused Jake extra pain, suffering, and possibly damage. When Jake's shunt would become clogged, his vitals were normal. He would become confused and vomit, but could still answer those ridiculous questions. When it got to the point that Jake was non-responsive, we were in trouble. That happened during one of our Hopkins stays, and the resident that was working just kept telling me, "Let's see how he is in an hour." I told him every hour, something isn't right. He continued to say, "Let's wait and see. His vitals are fine." I kept telling him his vitals are always going to be fine. Sometimes it's not about the vitals. It's about the behaviors of the patient and listening to the patient's parents. Doctors are in the patient's room 3 to 5 minutes some days. They don't know our child behaviorally like we do. Looking back, I pushed and wasn't listened to. I should have just called rapid response team myself instead of waiting for permission. After Jake passed away, that same doctor came back to Joe and I and apologized for not listening to us because we knew something was wrong. He said that we taught him something. We taught him to listen to parents and that he will never forget us. Doctors at times need to use parents as resources and work together. We know that there are parents that are extreme. We were not those parents. Parents, though, need to think about how they can aid in their child's care as well. Parents are the only ones that can bridge the gap in their child's medical services team. Doctors will float in and out of your child's room all day. You are the only constant one there. You have to take good notes. Keep records of conversations and treatments. Jot down any questions you have because the chances of you remembering them when you need to is not likely. One of the best things I did in terms of documentation was with Jake's medicines. I created a quick list on the computer. This was before the computer. And after each clinic visit, if meds or dosages were changed, I would print out a new sheet to keep with my notebook. The notebook went everywhere with me. Not only that, but I would take a picture of the medication list so that it was on my phone too. This came in handy when in the ER or ambulance. I always wanted to be prepared. It was much better than juggling a bunch of bottles. Cancer shows its patients how strong they truly are. They want nothing more than to beat this disease. And for the youngest victims that don't understand this terrible disease, their parents fight for them. Some will, and some, unfortunately, like Jake, will pass. It is up to us now as Jake's parents to continue to allow his voice to be heard, to continue seeking out help, to find new treatments and raise awareness of the importance of cancer research and treatments. Oddly enough, there is something positive that cancer does. There are many people trying to beat it, many trying to raise money, going through therapy and looking for a cure. Cancer brings people together that normally wouldn't find each other. We sit together in radiation waiting rooms, get to know one another's stories. All these people now belong to a club we wish we were not a part of. One thing remains the same, though, among all the people within this club. We all hate cancer, and we will fight with all we have for a cure. So, I apologize, this is the toughest part. I will close this morning with informing you that today, June 1st, 2016, Jake would have been celebrating his 16th birthday. Tonight, he will not be blowing out the candles on his birthday cake. Instead, we will be burning his radiation mask in his honor, because that is something he wished to do. We will not be singing happy birthday, but hope that the angels up above serenade him with the most beautiful birthday song ever sung. Thank you, Jake, for being so strong and teaching many of us to embrace the warrior within. We will continue to fight for you. Thank you so much.